Good morning, everyone. It is Monday, September 9th. Hope you had a great weekend and that this is the start of a great week ahead for you. My name is Casey Calamusa. I'm the Director of Communications here in Northwest Washington. I've been in this role for about 6 months with Providence. A little bit about me. Prior to that, I was with Seattle Children's Hospital and Research Institute for many years, working on their marketing and communications efforts. And I also spent a long time with the international humanitarian and global health organization World Vision, where among some of the highlights, I had the opportunity to lead the communications and media relations response to the earthquake and tsunami in Haiti and Japan, respectively, telling the stories of the survivors on the ground and the response needs that were needed after those disasters. So that has led me here, where I have been very fortunate and grateful to be part of the Providence family and all of the great work that's being done here, not just at the hospital, but also in the community. And the community benefit work, I think, is extremely meaningful, and I'm thankful to be a part of working with all of you to impact health for everyone in Snohomish County. I think it's very important, and the mission is a wonderful draw to all of us who work here, I think. I wanted to give a quick update on what we do here in the communications office at Pacific Campus. We are in charge of all of the internal and external communications for the service area. So everything from the core leader news and caregiver news newsletters that you hopefully receive each week. We work with stakeholders on that to curate the content, create the different topics that we're going to cover each week, and share the news that's of most importance to caregivers in the organization, things that people need to be aware of. We also overseeing all of our social media relations, working with the news media to tell stories about what is happening here within Providence, Northwest Washington, and hopefully shine a light on the work that all you are doing as caregivers. And so I'm wary of what I'm asking here, but one part of our role is to serve as internal reporters within the organization. But we are a limited team and can only be a few places at a time. So I am always looking to hear stories directly from you, from caregivers who are on the front lines, about the work that's being done and about amazing patient stories, amazing caregiver stories, in general, things that are of interest to others within the organization or that are worthy of being shared externally. And so I encourage you to please reach out and send me a note letting me know what's going on in your world and that you think might be of relevance to share more broadly, either internally or externally. We're always happy to hear those stories and then discuss with you the best way to potentially move those forward. So please do feel free to reach out to me about that. A few updates for this week. Hurricane Dorian struck last week, and One Blood in Florida is working with Bloodworks Northwest, and they're having a blood drive today in the first floor Rainier room from 10:30 to 4:30, where you can donate. They're particularly looking for type O blood and platelets, but if you're able to go and donate, that would mean a lot, and they'll be able to send that to Florida to help with the recovery efforts there. Also starting today, the Population Health Clinical Outreach Services team is going to be delivering enhanced text messages, so more than what's been done in the past, providing a link to an Epic-derived personalized care scorecard where patients can request a referral, schedule an appointment, and even log into MyChart. Also, September is Sepsis Awareness Month, which sepsis is a worldwide health crisis and affects over 30 million people across the globe and more than 2,000 people every year in our hospital alone. So to that end, the clinical analytics team will be honoring World Sepsis Day on Friday, September 13th from 10 a.m. to 2 p.m. near the gift shop on Colby campus. So if you're able to go down there, you can talk to them, to their sepsis nurses, to learn more about our sepsis prevention efforts. Finally, we want to make sure that you and your loved ones are protected with flu season coming up, flu vaccinations. Get your flu vaccination by October 31st. You don't have to wait for a clinic. You can go to get vaccinated at pharmacies in your community at any time. Providence Insurance should cover those community location vaccinations with no charge to you. If you do want to get something done on campus, clinics are scheduled for October 1st and 4th on Pacific and October 9th and 11th on Colby. And those clinics provide free vaccines for caregivers, volunteers, students, and providers with ID. So look for in caregiver news and on the intranet for more information about those. And I just wanted to close saying thank you for being the hands and feet of Providence. You are all doing amazing work in the community and caring for our patients each and every day. The mission of serving the poor and the vulnerable, I think, is a huge draw for all of us here. And I think that it shows that you are kind of the personification of the mission of why Providence exists and serves in the community. So thank you for all that you do, and I hope you have a great week.